A new statement published by the American Heart Association says discrimination is contributing to poor heart health for adult members of the LGBTQ community. News Channel 3's Caitlin Thrope spoke with a Valley doctor who says a different approach to training could be part of the solution.
According to a statement from the American Heart Association, 56% of LGBTQ adults and 70% of those who are transgender report experiencing some form of discrimination from a healthcare professional. Dr. Michael Jardula has been a primary care physician in Palm Springs for 16 years. He treats a large amount of people in the LGBTQ population at his practice. He also identifies himself as gay in the LGBTQ community.
We have to be really cognizant of what transgender, lesbian, and gay medicine is all about, and get to know what their communities, what their beliefs are, what their concerns are, and really try to effectively develop a rapport and trust. That's key.
He says people should not be afraid to go to the doctor.
We want them to trust us, not be afraid to hold back in terms of complaints, illnesses, seek out preventative care like everybody else.
Dr. Jardula shares how other physicians can help so their patients don't feel this way.
An introduction question so that you get to know what the patient is about and where they're coming from in terms of their sexual identity, in terms of that, do they have a significant partner? Do they have a relationship? Are they married? So you want to know their whole family dynamic.
He also says changes need to happen in the way healthcare professionals are trained.
It's important to kind of have the entire office, from the front desk to the nursing staff to the physician to when you leave, all be on the same page and to understand and be empathetic.
A 2018 online survey of students at 10 medical schools found about 80% of students did not feel competent to provide care for transgender patients.
The LGBT population does have its own inherent health issues that, if not addressed, will lead to more significant disease, particularly heart disease.
Transgender women may be at increased risk for cardiovascular disease due to the use of gender-affirming hormones like estrogen. Though more research is needed, Dr. Jardula says the scientific statement from the American Heart Association is a start in the right direction. In Palm Springs, Caitlin Thrope, News Channel 3.